Our next speaker, who's very modest, because when I said, how would you like me to introduce you? She just said, basically, tell them my name and where I'm from. So even though I'm sure there's lots to say, our next speaker, and before I do the name, I do want to say this about the presentation you're about to hear. One of the things that I've noticed, and this is more from a clinical perspective, is that for many of our students, whether it's we call neurodiversity or on the spectrum, it's often other conditions that these students have which are really causing the difficulties in their life. And I don't think people sort of appreciate the high rates of different comorbid conditions that individuals on the spectrum have, which is why I'm really excited that we now have our next speaker. Our next speaker is Dr. Aki Kawamoto from Counseling and Psychological Services. Dr. Kawamoto has a specialty in working with students on the spectrum or neurodiversity, and she's going to talk to us today about some of these different comorbid conditions. So without that further ado, do you want any of this passed out?
That would be great, but maybe I can explain what is going to discuss.
Okay.
Hi, I am Aki Kawamoto. I'm a licensed psychologist from CAPS, and today I'm going to talk about our awareness towards people with autism. And also, we just did the exercise, so I'm going to talk about self-regulation and also other common difficulties that students with autism tend to have at the university setting. And then just to let you know something about myself, I'm originally from Japan. I came to the United States about 20 years ago to attend a graduate school. So I got my PhD in clinical psychology, and I moved around after I graduated. So I've been licensed in different states, like in California, Indiana, Pennsylvania, and then I moved to Michigan last year. And I've been providing group therapy for students with autism for the past 6 years. So here is the overview of my presentation. For the next 30 minutes, I'm going to talk about what autism is, and then there are sensory issues that are very common among people with autism, and then different kinds of self-regulation and broader issues at the university. And I also want to include some of the multicultural considerations. And during my presentation, I want you to think about implications for the university, like what you can do to make changes. So this is the first exercise. It is not going to be very stimulating, but then if you don't want to participate, that's fine. But it's just a brief, simple exercise. So I want you to close your eyes, sit comfortably, and I'm going to ask you a question. When I ask you a question, I want you to pay attention to what comes to your mind first. It can be a feeling, thought, or it can be an image. Okay? So what comes to your mind when you hear autism or autism spectrum disorder? Okay, you can open your eyes. Anybody willing to share, what kind of thoughts or image or what came to your mind? challenges. Okay? Yes? Yes, Twitter. Yes, okay. Mhm. Okay, sorry. Assumptions. Okay. Yes. Yes. Actually, that's exactly what came to my mind. I've been working with a lot of students with autism. So when I asked this question to myself, that's the images that I had, like different faces of individuals that I worked with. How many of you here thought about something positive? Okay. So my next slides include some research findings. I think that a lot of people who think about autism, they tend to associate autism with intellectual disabilities. And there is a research study conducted every 2 years, and it is called Autism and Developmental Disability Monitoring Network. So every 2 years, they have surveillance study of children whose age is 8. So they are 8 years old. And the purpose of the research is to find out the prevalence rates and also associate characteristics with autism. So what they found is that about 30% of children with autism seem to have intellectual disabilities. I'm not sure if you think about this number to be too high, too low, or it's about what you have expected. And the researchers also found that about like a little bit less than half of children with autism had intellectual abilities that were about average or even higher. When we see students at college, we see a lot of students who are very intelligent and they tend to be doing well until like they graduate from high school, right? And some of the people with autism start to struggle as they enter university because of the systems are so different, and the availability of the support can be like affecting their functioning. And the research also addressed like a sex ratio. Have you ever heard the differences in sex ratio about autism? Yeah, it's 1 to 4. That means that autism is 4 times higher, more likely to be diagnosed among boys as compared to girls. But again, this is based on the research that is studying 8-year-old children. But then they have different sites across the United States, and they are estimating the rates and the characteristics. In terms of the race and ethnicity, we know that autism is prevalent among different racial ethnic groups, but when they just check who has been identified and receiving services, they found that there were more white children who have been identified and being receiving services as compared to other ethnic minority groups. So there are many factors that can be affecting these findings, right? We can speculate different things. But then what I wanted to point out is that what are the implications in the university then? We see more students who are very intelligent, and then we see more men with autism, and then we see more white students being identified with autism. In other words, we may be seeing more students who are female, by birth gender, birth sex, and then in terms of the race and ethnicity, we may also see some unidentified students with autism among different racial ethnic groups. Yes. Go ahead.
And I'm looking at race and ethnicity there, which also makes me think
Mm-hmm.
Makes me think, can you afford to get a diagnosis
That's really right.
or have that access where you would easily say to your pediatrician who will refer you to a psychiatrist?
Mm-hmm.
So have these numbers factored all that in?
No, it doesn't. It didn't factor anything in. Just this is a fact. But what you are saying is really true. Like accessibility to the healthcare services, where they live, what kind of health insurance do they have, and what about like how much they trust in like the services, health services. So all of those things can affect, and also some ethnic minority groups might have some biases towards like their children being diagnosed with a developmental condition. So there are different things affecting maybe this finding.
Because let me just very quickly, in that services can happen with a diagnosis as early as pre-K. It can also affect who we see here from ethnic groups and what services they had all along in K-12 that will prepare them to come to college.
Mm-hmm. That's really true. Okay. So this slide shows different abilities. It doesn't show all the abilities we have, but I just listed something that came to my mind. So people around like typical college age students, they tend to have like an equally developed cognitive abilities as compared to like different things. As you can see, maybe you can think about yourself, like what you may be very good at and you may not be very good at. But people without like a disability or developmental conditions or autism tend to have about equally developed abilities. And again, it can be influenced by age too. Like when we age, the different abilities like tend to decline, but we also gain other abilities. But I'm talking about college students here. And here's a picture of Einstein, right? Think about what kind of abilities maybe he had a strength in. And he is a Mozart. What do you think about his talent and abilities? Michelangelo, again. Thomas Jefferson. And Emily Dickinson. I'm just like talking about those like famous individuals because like people speculate that they seems to have had some autistic traits. And when we look at abilities among people with autism, we do see strengths in different areas. It depends on the person. So some person can be really strong in memory or like very good at like quickly processing the information. But other people may be very good at written expression or reading or oral expression. So it really depends on the person. But their difficulties tend to cluster into these two areas. I'm just using the DSM-5 criteria here. So social communication interaction, like people with autism tend to struggle, and also restricted interest and repetitive behavior. But not so many people talk about hyper or hyperreactivity to sensory input. This is something we've been talking about today earlier. And the reason why people don't talk about these sensory issues with autism is that in DSM, now we use DSM-5. It was revised in 2012, but prior to that, these sensory issues were not included in the criteria. So it was not mentioned at all. And people who had autism or sensory issues, they had different kind of diagnosis, not like together with autism and sensory issues. So let's focus on hyper and hypersensitivity. When we are talking about sensitivity, there can be different kinds of sensitivity. It can be light, like somebody said, bright light, or fluorescent light. Touch, like some people might have touch, might prefer specific texture. smell can bother some individuals. The temperature can be very common. Like I see a lot of students with autism maybe being very sensitive to the heat. So we may see students wearing t-shirt or sandals in the winter. Noise, like a lot of noise, can be very destructive. And certain food or medications, like people may tend to react very differently. And the combination of stimuli, different stimuli, can also affect those individuals. So what happens when we are overwhelmed or overstimulated, right? This is what we just did during our exercise. So here are the examples. Like people tend to feel anxious when their mind is kind of shutting down because it's just too much stimuli, right? And some people might have a panic attack. Some people may start screaming or crying. Some people may be more agitated and feeling irritable. Talking to self can be also common. And this is our natural reaction, but if something is bothering us a lot, we want to escape from the place, right? So maybe like running away. And another extreme reactions can be like feeling really dizzy, like feeling like going to faint, or feeling dissociated. So maybe not paying really, like being aware of their surroundings anymore because brain is shutting down. When that happens, then how do you calm yourself down? Like when you feel overwhelmed or overstimulated, how do you calm yourself down? Like can somebody share what you do? Okay, deep breathing, okay? Yes, curls up in the ball, like on the floor. Yeah, yeah. Yeah, okay, thank you for sharing. So next I'm gonna talk about like self-regulation. When we are overstimulated, we want to encourage the individuals to find out what are the triggers and what kind of physical or emotional signs they have. So the triggers can be certain kind of stimuli, and the signs can be like heart palpitation or feeling kind of shaky or not feeling right, like something is wrong. And then people can use different techniques. It can be cognitive behavioral techniques or other things that are very soothing for them. Psychologists often talk about like thought stopping, refocusing, or grounding techniques. So when something is very stimulating, like too much, then we may teach the person to think about maybe being a stop sign and then do some kind of grounding technique. If they are overstimulated by like a noise, then we can encourage the person to focus on something else. So for example, you are sitting on the chair. So if you are feeling overwhelmed, you may focus on the chair you are sitting on and just looking at the color, how it feels like, how hard it is. Just observe the chair, like as if you are looking at the object for the first time. So that's one of the technique. And the behavioral things that people can do is just to leave the place or do the deep breathing. And there can be different kind of things that people find it soothing. But I noticed that while working with people with autism, psychologists often don't talk about sensory methods. And a lot of occupational therapists actually do. And this is what my group members shared during our first group at the University of Michigan. And I'm going to pass around these stimatoids so that you can kind of touch and feel what it is like. And one of them is the headphones. If you like, you can also try it on and see how it feels like when you're blocking noises. And then there are other reactions that are kind of concerning to other people without autism. But people with autism can react to like these stimuli in a very unusual way. It can be like talking to themselves very loudly, but if we don't know what's going on to them, then we may become very concerned, right? And the rocking may be very common, or isolating themselves, or just isolating and staying in a dark place for a while. Sometimes, like what the person in the front row shared, but sometimes people with autism, they like the tactile things, like they might find it very soothing. So maybe lying down on the hard floor, like hardwood floor, and feeling the temperature or the hardness can be very calming. Or maybe taking a shower and feeling the pressure of the water can be calming for people with autism. But these things that people who are neurotypical, they may not know, like how calming that can be. So what are the common struggles when students are having like a sensory reactivity, right? What we often hear is that and it's difficult to find a place where they can kind of shut down all the sensory stimuli. And another thing that is also common is that people are concerned about how other people are going to judge them if they're going to have a panic attack or they are going to have a meltdown. And they're also concerned about if other people are going to reject them as a result. And if they get into a withdrawal, like a kind of isolating themselves in the room for a few days, a few hours, I don't know how long, it depends on the person, but it can affect their academic performance. But I also want to talk about the strengths. Because of the sensory reactivity, it's also possible that they have a great strength. Right? Like somebody who is really sensitive to the sounds, maybe they might have a great musical talent. Or if they are good at visual stimuli, like noticing different colors, a mixture of different colors, they may be very good at artistic expressions, like painting. And another area that people with autism tend to struggle is the social area, right? Social interactions. And we know that people tend to have difficulties having a conversation, engaging in a small talk, developing relationships, understanding what other people may be thinking at the moment, and also handling more difficult, complex social situations. So those are things that people tend to know about their social issues. But what about strengths? What kind of strengths do you think they might have because of the social difficulties they have? Mm-hmm. Yeah, if they are paying attention to different things, maybe they are very good at focusing on very small signs.
They're good at detail.
Yeah, good at details. Mm-hmm.
Good memory.
Mm-hmm. So the strengths can be different depending on the individuals, but oftentimes, have you heard that people on the spectrum, it's very difficult for them to lie. And people tend to have high moral standards. So they are very good at advocating for others. They may not be very good at advocating for themselves, but they may be having strong social justice. And they can be also very sensitive towards other people because they are struggling in the social area. They may be paying a lot of attention to how other people might be thinking, and they may be overly polite or very sensitive about not offending other people. And here it's the behavioral issues that people tend to have. So we know that they tend to engage in kind of rigid behaviors. They tend to kind of prefer having some routines, might have difficulties adapting new situations, but they can be too precise or detail-oriented, so these things can start affecting their, how they live their life, their daily life. But strengths, again, can be, because of the strong interest, it can be great, like a knowledge base, or being highly like rational, maybe very good at solving problems. What I hear, because of all of those difficulties associated with the condition, what that I hear among students with autism, it is very common that for students to feel alienated, like isolated. And then oftentimes students just focus on the academic area and may not be like engaging in other activities. Like many of them try different things, but they kind of give up because it's kind of difficult for them to feel like they are accepted. And about self-advocacy, it can be difficult, like sometimes for them to recognize what kind of difficulties, if they need any help, like where they can get that kind of support. And because of the like struggles throughout their life, feeling like they are different from other people, a lot of people have a history of being bullied, like it can also affect their self-esteem, like feeling isolated. And that's what Stuart was saying before my presentation. It is very common for people with autism to have other psychological conditions such as depression, anxiety, and social anxiety. And then there are individuals with multiple minority identities, right? So what does that mean to them? Can they fit in, like can they find a group that they really can feel like being accepted? What about the resources? What about the social support? Those things are something that we can think about. So I'm gonna talk about my group therapy towards the end of my presentation. So at CAPS, I'm offering a support group for students with autism. And the group, it's every Friday, some students need to make a commitment, like if they can, throughout the semester, and it's Fridays from 3 to 4:30. And these are the things that we do in the group. So have a place for people to feel accepted, address different kind of issues, and problem solve or get support from each other. And also this happened spontaneously, but group members started sharing resources. That's why I'm also sharing those resources that I learned from those students today. And then they can also socialize with each other, create a safe environment where they feel like they can fit in. And then if they like, they can practice new skills. The things that students find very valuable about this group, the number one thing that is listed here was to have a place to be themselves and feel accepted. It seems like this is what it is lacking for them, like this kind of experience in the university. Like in order to fit in, they pay attention to small details, or they try to change the way they are. Maybe they have a tendency to speak loudly, but they know that like that's not really like accepted. The people kind of have reactions, so they try to adjust like who they are depending on who they are interacting with. But it can also affect their self-esteem, like being their true self or being the person that other people want them to be. So again, I want to conclude my presentation with the pictures of famous individuals like Einstein, Mozart, Michelangelo, Thomas Jefferson, and Emily Dickinson. I'm not saying that a lot of people with autism, or all people with autism have some kind of a savant traits or very outstanding abilities. What I'm trying to say is that when we hear autism or when we think about autism, I want to encourage us to think about their difficulties, but also strengths and their unique being. And we can make the campus to be inclusive and welcoming for those students with autism. So that's my message. And at the end, here are the resources. I think that may be very helpful for all of you. And if you would like to get this list, I have have a sheet where you can put your name and email address. So I can send it to you today or tomorrow, the list of resources. So the first one, meltdowns, the students in the group found it very helpful when struggling with overstimulation. It has a step-by-step instruction, like have you eaten food? If their answer is no, then there is a suggestion, like think about doing this. Have you taken medications, or have you been taking care of yourself, or are you feeling stressed out? So this is a step-by-step website. It's under meltdowns. And understanding the condition, Melanie talked about Autistic Self-Advocacy Network several times today. But then again, this organization created simple an information, the packet for people who want to understand autism. And I have the packet here if you are interested in looking at. And here is also another resources for people who work with students with autism, and also for students and parents. Thank you.
Are there any questions that people have? We have a couple minutes if there are any questions. Question back there.
Yes.
I'm really excited to hear that you have the group therapy session starting on Fridays. Do students have to have a diagnosis to be able to attend that?
Not everybody have been formally diagnosed, but I do see a student individually before they join the group, and I do the screening, whether they are going to benefit from this group as compared to other groups that we have at CAPS.
So I just want to be clear on what you just said. A student just can't show up to that group. They first have to have an appointment with you.
That's right. They have to first call CAPS and make an appointment with me so I can offer group screening.
Is that information on the CAPS website?
About the group?
Yes, and how to access it?
Yes.
Great.
So if you go to CAPS website and under the clinical services, you will see the list of groups, and the one that is called Autism Support Group. Yes.
Are those groups for, targeted for mostly the older individuals with autism, or are those also for younger?
This group is both for both undergraduate and graduate students.
I just wonder how many students are in the group, and is that
Mhm.
are you
Yeah,
continually adding?
so
to
we
that?
have 8 students in the group currently, but I don't want to exclude any people who are interested in joining. So if I get a lot of students